Welcome back to From Fear to Fun, the podcast where we explore how to transform medical encounters with children from moments of fear into opportunities for fun, with connection, confidence, and cooperation. I'm so glad that you are here. Today's podcast is different. Here I will explain something I try to avoid at all times: how to physically support a child during an examination, or with other words, how to restrain a child during the physical aspect of the consultation. Most of the time, with connection, respect, and good preparation, children cooperate beautifully. But occasionally, especially when a child is very small or very frightened, we reach a moment where we must decide: do we need to proceed with the examination? And if so, how do we support the child safely? Let's walk through this with clarity and compassion. Before touching the child, we must ask ourselves, how important is this examination right now? Sometimes the answer is, it can wait. And then waiting is the kindest option. But sometimes the examination is essential for diagnosis, for safety, or for urgent decision-making. If we have to proceed, then the effort must be worth it, worth the stress, worth the potential fear, and worth the emotional cost. So if the answer is yes, then we move to the next question: how do we do this in the safest, quickest, and least traumatic way? In the cases that the child needs physical support, the next decision for the medical specialist is who is the best person to hold them. Not every parent is suitable for this role. If the parent themselves is terrified, mistrustful, or overwhelmed, or on the other hand, if they are emotionally frozen, then they cannot provide the calm, steady support the child needs at this very moment. In those cases, a nurse, a medical student, or another trained staff member is often the better choice. Why? Because generally the parent and the parent's body should remain a place of safety, not a place associated with restraint. On the other hand, only when the parent buy into the necessity of the examination, they can become willing to cooperate with us for the child's benefit. If they are not so sure, then their support to the child insufficiently strong, insufficiently targeted, and insufficiently consistent throughout the examination process. Here exists a variety of methods how to restrain a child. Unfortunately, the standard common way is quite inefficient. In the common way, the child is facing the examiner, is sitting or standing between the supporter's leg, while the supporter is wrapping the arms around the child's arms and head. This seems to look secure, but actually it isn't. The child can still wiggle sideways, the child can twist, kick, or throw the head back, and none of these movements will be supportive for an efficient examination. And the longer the examination takes, the higher the amount of distress for everybody. But there is another way. A safe, efficient, and respectful way to support a child is the side-sitting lap position. Let's break it down step by step. Step 1. Sit the child sideways on the knee of the adult supporter. Step 2. Place the child's leg between the adult's leg to prevent kicking. Step 3. Secure the child's leg gently with the adult's legs. Step 4. Position the child's bottom close to the adult's hip to prevent sideways wriggling. Step 5. Slide the child's near arm around the adult's waist reaching behind the adult's back. Step 6. Rest the child's head against the adult's chest, supported by the hand near to the child's back. And step 7 and last step, hold the child's far wrist gently with the adult's hand facing the child's face. This position stabilizes the leg, stabilizes the arms, stabilizes the head, and keeps the child close to a warm, calm body. This allows the examiner full access to one ear, the nose, and the mouth. To examine the other ear, simply switch sides. This method works from neonatal age up to around 10 years old. Whenever possible, I prefer a nurse or medical student to hold the child. Why? Because this way the parent remains the emotional safe base. The child does not associate parental closeness with restraint, and the parent can stay calm and supportive. Last not least, the child can return to the parent for comfort immediately when the examination is done. This preserves the parent-child bond during a stressful moment. And even more, when the examination is done, I typically apologize to the child for the inconvenience caused. And the reason for this is because I did violate the child's personal boundaries, and I did do something that the child didn't want me to do, regardless how important the examination was. In a nutshell, if you need to physically support a child for an examination, decide first whether the examination is truly necessary. Choose the right supporter and use a position that is safe, efficient, and respectful. And after that is set up, complete the procedure quickly and confidentially. Because physical support should never be rough, chaotic, or prolonged. Thank you for listening to From Fear to Fun. Next time, we take a closer look at one specific age group, teenagers and their specific needs. Until then, remain curious, offer connection, and keep moving from fear to fun.